Good afternoon and welcome to our webinar, Workplace Alcohol Abuse and the Future of Alcohol Screening. We'd like to recognize our sponsors today, SOBRsafe. They've brought with them today a short video they'd like to share with us. So before we turn the microphone over to Bill and Michael, who are our presenters for today, we'll go ahead and share with you that video.
Every driver on the road, every operator on the job, every pilot in the sky should be sober, period. Yet alcohol-related accident rates continue to climb, and the technology has not kept pace with this epidemic, until now. Business owners and insurance carriers alike recognize that preventive solution is needed, now more than ever. SOBRsafe is a disruptive new force in the market, a touch-based alcohol detector proudly built in the USA. So here's how it works. By simply placing a finger on a sensor, the user receives results in mere seconds. And temperature, humidity, and barometric pressure sensors calibrate each reading, ensuring both accuracy and consistency across applications and environments. Through our global cloud-based communications platform, managers receive immediate notification of test results. Our mission is to eliminate the destructive impact of alcohol on our roadways and workplaces. And with this disruptive solution, we are bringing safety to our communities with just the touch of a finger. Contact us to begin the conversation.
Thank you for that short video, SOBRsafe. With us from SOBRsafe, we have with us today Michael Watson. Michael Watson comes to us with 5 years of sales and marketing experience, and it has been published as an industry expert in the Wall Street Journal, Newsweek, and others. Michael is a professor of management at the Oakland University School of Business and a trustee for the Detroit Public Television. Also with us from Current Consulting Group is Bill Current, who is the author of Why Drug Testing Updated and Expanded for 2020, along with other substance abuse related books. He founded the Current Consulting Group in 1998, and it has become the #1 recognized brand name in compliance, business development, and operations consulting in the drug testing industry. So we'd like to go ahead and turn the virtual microphones over to Bill and Michael for our presentation.
Thank you, Jessica. And before we launch into the presentation, one, I just want to thank SOBRsafe for sponsoring today's webinar presentation. And also, Michael, just to give you a few minutes to talk a little bit about SOBRsafe. The video was great, loved it, but maybe there's a little bit you want to tell us about the company.
Sure, Bill. Thank you for having us. We really appreciate it. Excuse me, SOBRsafe, we've been on a journey for about 4 years now developing this product. It's been a journey that's had some twists and turns, as is the case in many startup organizations. And today we're actually going to talk to you about 2 products: our SOBRcheck product, which is the product you saw in the video, and also we're going to unveil today a wearable product. So we're very excited. As we mentioned in the video, our mission is all about creating a safer and healthier work environment, and in the end, saving lives.
Thank you, Michael. Let me turn my camera back on. So a couple of things I want to bring up. We're going to talk about alcohol abuse and alcohol abuse in the workplace in particular. We're going to talk about different alcohol screening methods. And as I go through the presentation, I would like to invite you to ask any questions that you'd like to ask about substance abuse in the workplace, alcohol testing in particular. And then towards the end of really the second half of the presentation, I'm going to bring Michael back in because I've got some questions I'd like to go through with him. Some of you probably met Michael and his team from SOBRsafe at the NDASA conference back in May in Indianapolis. We actually have some pictures from that. We're going to share some of that and go into a few questions about how SOBRsafe fits into a drug-free workplace program that includes alcohol screening. So I'm going to talk about the magnitude of the problem, sort of like I said, some traditional screening methods, collecting or doing an alcohol test without collecting a bodily specimen of some sort, and then we'll bring Michael back in and we'll talk about a few things together. So let me go to my first slide, and what I want to do first is, so let me share just a couple of facts to sort of set the table first. According to the National Council on Alcohol and Drug Dependence, so this is an organization that's been around a long time. Back in the days when I was the executive director of the American Council for Drug Education, we interacted with the National Council on Alcohol and Drug Dependence a lot. And so they've been around for a long time, and they really know their stuff. According to a study that they did, and this was not that long ago, workers with alcohol problems are 2.7 times more likely than workers without drinking problems to have an injury-related absences. Hospital emergency department study found that 35% of patients with occupational injury were at-risk drinkers. And breathalyzer tests detected alcohol in 16% of emergency room patients injured at work. Also, from the same report, let me see, analysis from workplace fatalities showed that at least 11% of victims had been drinking. And then there was a large federal survey that was done that showed that 24% of workers report drinking during the work day at least once in the past year. I've got some more current information on that shows the rate of drinking at work every week. I'll share that with you in a minute. And then 20% of workers and managers across a wide range of industries and company sizes said that a coworker's on or off the job drinking jeopardized their own productivity and safety. And by their own, we're talking about the non-problem drinker, the non-substance abusing worker. So 20% of people who don't have a problem with it said some of their coworkers on or off the job drinking was jeopardizing their own productivity and safety in the workplace. So let's talk about the magnitude of the problem. And as I launch into this, there's such a focus at times on drug abuse, illicit drugs, marijuana, cocaine, especially opioids nowadays with the rise in opioid overdoses and opioid fatalities. But alcohol abuse continues to be the bigger problem. Alcohol is by far the #1 substance of abuse in American workplaces. So if you just keep track of these things through the internet, and that's how most of us get our news nowadays, the headlines really tell the story. I'm not going to go through all of these, but you can see there's a lot of different states represented just from this sort of random selection of headlines on workplace alcohol-related problems, accidents, injuries, etc. And there were a lot more than this. I just stopped at these ones, but there were a lot that had to do with school bus drivers in particular. So fleet drivers, moving companies, as you see on that last one, school bus drivers, etc. There's a problem with alcohol abuse that puts people's lives and safety in jeopardy. And the headlines are clear on that. Now you're going to get the recording to this presentation today, so I put the sources at the bottom of a lot of these slides, but this is a recent study from that showed, this is from, if you look down there at the bottom, this is from Business Wire, 1 year into the pandemic. So this is a year ago when this study came out, this report. This was from an annual substance abuse report that they do, revealed that significant increases in alcohol and other substances had occurred or were in the process since the start of the pandemic, affecting 49% of American workers. Here's a few highlights from the study last year. Of the 49% of workers who reported struggling with some level of addiction, either from drugs or from alcohol, a number of workers reported lower productivity and missed work because of their substance abuse problem, and it had doubled since the 2019 report. So in a 2-year period, problems with productivity and missed work, as identified with people struggling with drug and alcohol problems, had doubled just in a 2-year period of time, with 36% reporting that it had affected their work more since the pandemic began. Nearly half of all full-time workers now report problem use of alcohol, drugs, and prescription medication, and 1 in 5, 19%, report at least weekly usage. But this is a direct quote from the study: alcohol remains the most common substance abused by workers in America. How many people use drugs? Well, every year, the Substance Abuse and Mental Health Services Administration, SAMHSA, puts out a study called the National Report on Drug Use and Health, National Survey on Drug Use and Health. And they report drug abuse levels in a self-identified survey. So in other words, the surveyor calls an individual and they identify themselves as conducting the survey on behalf of the federal government, and then they ask a series of questions about an individual's illegal drug use activities and alcohol abuse activities, etc. So the problem is probably greater than the study actually reports. But from the most recent National Survey on Drug Use and Health, 59.3 million Americans 12 and older admit to using illicit drugs, and 138.5 million people admit to being current alcohol users. Now, we break that down into two categories: binge drinkers and heavy drinkers. So among binge drinkers, 61.6 million. Those are people who admit to having at least 5 drinks on at least one occasion in the last month. And heavy drinkers, 17.7 million, are people who admit to having 5 or more drinks on at least 5 occasions in the last 30 days. These are people who drink a lot, and there are a lot of them. How many substance abusers are employed? Well, the National Safety Council reported at the end of 2020, so this goes back a year and a half almost, 75% of people with a substance abuse disorder are employed. That comes out to between 15 and 17% of the American workforce. How many use drugs and alcohol at work? A survey conducted by the American Addiction Centers found that 22.5% of employees who admit to using drugs at work. Now, follow me on these next 3 bullets. 14.7% of at-home workers and 3.3% of people who go to a workplace admit to being high on the job. So 22.5% of employees admit to using drugs. So that's higher than the 15 to 17% that the government reports. But 14.5% and 3.3% of at-home and at-work workers admit to being high on the job at least every week. Not every day necessarily, but weekly. Now, the pandemic's had a big impact on this. There's no question about that. Substance abuse levels have skyrocketed since the pandemic came on. So this is a report from LifeWorks and the Hazelton Betty Ford Foundation. Nearly 1/3 who drink alcohol admit that they've increased their consumption since the pandemic began, and about 30% of drug users admit the same thing. So we're still in the pandemic in many respects. And if you go back to that previous slide about at-home workers, many companies that went remote during the height of the pandemic in the early months of 2020 have remained that way. About 32% of companies say they're going to continue to have their workers work from home or from remote locations. So that's a problem when you consider the fact that drug abuse is up as a result and alcohol abuse is up as a result of the pandemic, and a lot of people are working from home and they're basically unsupervised. And many of those people admit that they've been high at work working from home. Now, I threw this in at the last minute. I thought you would find it interesting. There's a source down at the bottom, but this is trends in alcohol use disorder related to mortality before and during COVID-19, so 2012 to 2021. But just if you follow the vertical bars, you can see that the mortality rate associated with alcohol abuse has increased dramatically since the start of the pandemic. You see those blue bars on the right for 2020 and 21 going up significantly compared to prior to that, but certainly back to 2012. So alcohol use is up, and the mortality rate associated with alcohol abuse is up significantly. So if you're an employer and you're concerned with substance abuse in the workplace, you know what the signs of substance abuse are. You know what the signs of alcohol abuse are. They're all on the screen here. I'm not going to go bullet by bullet with you. I do want to point out just a few things. So when somebody shows up and they smell of alcohol, their eyes are bloodshot, their slurred speech, etc., we know there's a problem. It may not be a substance abuse problem, but it likely is if certain outward manifestations are present. But if you look on the left column, you see unintentional injuries to oneself or others. So it's not as if an individual goes to work intending to cause an accident, but when they go to work under the influence of alcohol, or they're at work and they consume alcohol and they become under the influence, then they can cause an accident. Accident rates are significantly higher with alcohol and drug abusing workers than those who don't abuse drugs. Now let's just use the government percentage of 15 to 17%. Let's say it's 15%. So 15% of American workers have a substance abuse problem, the majority being alcohol abusers. That means that 85% didn't identify themselves as substance abusers. So as an employer, I'm concerned about the effect of that 15% on my 85% who come to work every day not under the influence of alcohol, ready to work, trying to be productive, hoping to keep their jobs, right? And they're affected by the substance abuse of these other individuals. Unintended accidents caused by substance abusers is a significant problem in the workplace. Any discussion about alcohol abuse in the workplace will automatically take us to the Americans with Disabilities Act. Now, we could do an entire webinar presentation on the ADA. We could also do it on an entire presentation or two, actually, on the Equal Employment Opportunity Commission directives and policies and rulings when it comes to substance abuse and defining the ADA in workplace situations. We're not going to spend that much time on it today, but I do want to bring up a few key points when it comes to the ADA and alcohol abuse and alcohol screening, because there's no way to disconnect those points. So first of all, let's just review what a person with a disability is or is defined as under the ADA, because this is critical. It starts with the definition of what a person with a disability is. So, and I'm not going to try to paraphrase this. Let me just read those first two bullets. A physical or mental impairment that substantially limits one or more major life activities. Now go down to the bottom, you see the asterisk there. Major life activities include but are not limited to walking, seeing, caring for oneself, learning, working, thinking, communicating, and also the operation of bodily functions. If one or more of those life activities is disrupted or impaired, that individual probably falls under the definition of a person with a disability under the ADA. Now look at the second bullet. This is important. A history of impairment that substantially limited one or more major life activities, or someone in recovery from illegal use of drugs. Now under the ADA, a current alcohol abuser is a protected person. In other words, current alcohol abusers are a protected class under the ADA. And so certain restrictions apply to what employers can and cannot do with them. I'm going to clarify that in another slide. Current drug abusers, though, are not protected under the ADA, but somebody who's currently in treatment for drug abuse is typically considered part of a protected class under the Americans with Disabilities Act. Now, I want to read something from that third bullet here in a second, but you kind of get the distinction. There's a difference between a current alcohol abuser or somebody with an alcohol disorder and a current drug abuser versus somebody who's in drug treatment. Now to the third point. So a person has a disability under the ADA if that person has been regarded as having such an impairment, someone who has a family member who has HIV, for example, so is assumed to have HIV as well and may face discrimination as a result. Now, I'm not talking about HIV here, but that could spill over into some form of discrimination against an individual if somebody in their life is an alcohol abuser. So there's a fine line there, and I'm not suggesting that every alcohol abuser or non-alcohol abuser is somehow being discriminated against because maybe a spouse or someone else in their family is, but there's a potential possibility of discrimination there, so you want to be aware of that. Now, under the Americans with Disabilities Act, let's talk about alcoholism. Alcoholism is typically considered an impairment, and if it substantially limits a major life activity, then it will likely constitute a disability, as I talked about. An employer may be required to provide an accommodation to that individual, like allowing them to take time off from work to participate in some type of counseling or treatment. But look at the third bullet. However, an employer can discipline, discharge, and deny employment to an alcoholic whose use of alcohol adversely affects job performance or conduct. An employer also may prohibit the use of alcohol in the workplace and can require that employees not be under the influence of alcohol while at work. I think sometimes, and this sort of equates to the legalization of marijuana in a way, where employers become a little bit fearful of addressing this issue with their drug-free workplace policy for fear of running up against the Americans with Disabilities Act. The ADA specifically allows employers to prohibit individuals from being at work under the influence of alcohol. You don't have to allow that. You don't have to accommodate that for a person with an alcohol use disorder. The ADA is very specific on that. The Ninth Circuit Court, this goes back to 1995, right? The Ninth Circuit Court found in favor of an employer in a case in which an alcoholic was claiming discrimination. Quoting from it was a long case summary. I read the whole thing practically, but just quoting a portion about alcoholics are not exempt from reasonable rules of conduct. So an individual who has an alcohol use disorder still has to be able to perform the jobs that they've been hired to do. A reasonable accommodation is to allow that individual perhaps to have time off if necessary to participate in some kind of counseling or treatment program, but it doesn't require the employer to allow that individual to be at work under the influence of alcohol. Sometimes I think employers get a little bit skittish when it comes to addressing alcohol abuse in the workplace because of the ADA. The ADA actually works to your benefit as an employer, in my opinion. Now, again, we won't go through the EEOC policies, etc., in this presentation. Maybe in a future one, we'll take the time to do that. But if you visit the EEOC website, you'll find a lot of information, excuse me, and a lot of scenarios that would be helpful to you in sort of, seeing how specific situations may or may not be applied to the ADA when addressing alcohol abuse in the workplace. I do want to spend a few minutes on state drug testing and alcohol testing laws. So first of all, every state is different. Every state has its own legal requirements when it comes to alcohol and alcohol abuse, and what employers can do about that. Excuse me. No state prohibits employers from conducting alcohol testing. You do have to comply with state laws, with federal regulations. There are some states that actually require alcohol testing under certain circumstances. Excuse me. If you're in a state that offers a workers' comp premium discount, you may be required to do, say, post-accident or reasonable suspicion alcohol testing. Some states actually require workplace alcohol tests to be conducted in accordance with specific guidelines, and usually those guidelines are straight out of the federal guidelines, 49 CFR Part 40. So be aware of that there may be conditions in some of the states where you do business that are very specific in how you conduct or how you address alcohol abuse in the workplace. The DOT regulations still require employers to test for marijuana, cocaine, amphetamines, heroin, and PCP, and also alcohol under certain circumstances. So there's no state law that prohibits it, and there's no federal law that doesn't allow it, or in the case of the DOT regulations, it actually requires alcohol testing under certain circumstances. Now, no state law directly or indirectly prohibits alcohol screening using a touch sensor technology like you saw in the video from SOBRsafe. So we're going to talk about that in a minute, and I'm going to bring Michael back here in just a couple of slides. But you still have the right as an employer to prohibit employees from bringing alcohol into the workplace, from consuming alcohol while on the job, or being under the influence of alcohol while at work. Now, here's another map. This is the map on the right there that shows the states that have legalized marijuana. The ones in orange have legalized recreational use of marijuana, and the ones in blue have legalized medicinal marijuana. All the orange ones also have medical marijuana laws as well. But you get kind of a feel for the legal status of marijuana in the United States looking at this map. There was a study done not too long ago, I think it was 2015, and I put the source down there at the bottom so you can look it up and read the whole thing. But I'm quoting from the executive summary of the study, that it was a study that was about the prevalence of alcohol and marijuana use simultaneously. So this is what it said. The prevalence of simultaneous use was almost twice as high as concurrent use, implying that individuals who use both cannabis and alcohol tend to use them at the same time. In other words, people who are using marijuana are also using alcohol at the same time. Furthermore, simultaneous use was associated with increased frequency and quantity of alcohol use. Simultaneous use was also the most detrimental compared to alcohol only. Simultaneous use of marijuana and alcohol approximately doubled the odds of drunk driving, social consequences, and harms to self. Now, when you think about harms to self, we're talking about accidents. If we're talking about the workplace, we're talking about, you know, people operating a forklift or driving a delivery van or truck who could be smoking marijuana, because the rate of marijuana use has increased dramatically in the United States since the legalization movement really caught hold. And a study from Quest Diagnostics found that the positivity rate for marijuana in marijuana drug tests had gone up dramatically over the last several years in the states in orange, the ones that have legalized recreational use. So you have marijuana use going up significantly throughout the country, but especially in states that have legalized marijuana. And we now, you know, kind of associate that with the study that shows that marijuana users are more likely to also be abusing alcohol at the same time. And this leads to drunk driving, social consequences, and harms to self. So with all of that under consideration, let's bring Michael Watson back into the webinar, and let's talk about a few specific points. So Michael, are you with us? Let's see.
Yes, Bill, I'm back.
Welcome to the presentation. I really enjoyed seeing you guys at the NDASA conference in Indianapolis back in May, and I've got a couple of pictures from it. Tell us how the conference went for you guys and what's going on in these pictures here.
Yeah, so the conference was the worldwide debut of our SOBRcheck device. As you know, Bill, and others, I'll let them know right now. Our company, which by the way, in the video, a quick correction, it says that we're an over-the-counter stock. We're now listed on the NASDAQ exchange. Our ticker symbol is SOBR, if you're interested. A little plug there. But at the NDASA show, we went to Revenue in January. That was the first public debut of the product. And you'll see at the tables here, our team from SOBRsafe on the left side. On the right side are attendees from the conference that are in line. We sponsored the cocktail party at the conference. And in order to get a drink ticket, you had to come up and put your hand on the SOBRsafe device. And we had amazing response. You know, the interesting thing about the product, Bill, is it's so new. It's not like anything that's been out there in the drug and alcohol space. I often say that it's not like, you know, when Tesla introduced their new vehicle, there had already been 50,000 cars. You didn't have to, you know much about it. You knew it was another car. You know how to drive it. You know, there wasn't a lot of education that had to go on, but nothing like this has been out in the drug and alcohol testing space. So people are mesmerized at first. I'd say their heads are spinning a little bit. They test on the device, they get their drink ticket, they go get a drink, and they come right back to watch other people test to see how it works. They were very, very much in amazement. And then they wanted to quickly get to a point where they tested positive for alcohol because they wanted to see it work. And of course, we didn't fail them there. We kept giving them enough drink tickets to get to that point. But typically, it took 1 to 2 drinks for people to test positive. But it was a very enlightening experience for folks, and we had just very heartfelt welcome to that group. So.
Yeah, I noticed on the left there was actually quite a line of people waiting to take the test, presumably to get their drink tickets. But
yeah, that was the opening line there.
Yeah, it seemed like that night your table there was just constantly occupied.
Yeah, constant flow of people. But the nice thing is we had enough devices there where people didn't have to wait. And you know that when we install these in the workplace, we have an algorithm that we follow to know how many devices to put at each entry point so that we don't cause any slowdowns entering the workplace.
Okay, well, that actually leads to my next question, which is, I heard you talk at the NDASA conference, and obviously we've talked other times as well. And I hear you using this term culture of prevention. What are you talking about when you say culture of prevention, and how does SOBRsafe actually, factor into that?
Sure. And it's interesting. I think it kind of goes along with some of your comments from the last few slides, in particular, about protected classes, et cetera. We actually, our device is so quick at doing a scan that we can scan everybody every time they enter the building. So it takes away any fears or words of people feeling like they're discriminated against. There's no discrimination. Everybody tests all the time, and it's instantaneous. And what the result of that is, in the first couple of days when we're at a new company, what's interesting is we find out from the employees, everybody at the company knows who's drinking at the company. They all know, but never, ever, ever do they tell the management who those people are. So after we register people into the system, they're very relieved. They're relieved that everybody's going to be tested every day. I think a lot of people live in a fear in the workplace that they could get injured by somebody who's drinking. And certainly there would be retaliation if they were reported. So after our device is installed for a few days, the first couple of days, we'll deal with, your typical administrative things. One of the questions we always get is, does hand sanitizer set off the device? And of course it does, because it's ethanol. It's an ethanol sensor. Not all hand sanitizer, though. We provide hand sanitizer that does not have alcohol. And really, that's part of our training too. We tell them when they register not to wear hand sanitizer, and they don't. Nobody wants to create a false positive because it just sheds the wrong light, right? So what happens after the first couple of days is no one tests positive for alcohol because it becomes that big of a deterrent. It becomes, I sometimes say to people, it turns from an alcohol detection device to an IQ device, right? I mean, if you know you're going to be detected, you wouldn't come in under the influence. So that right there, that whole deterrence factor is really the catalyst for prevention in the work, for creating that culture of prevention. And then everybody feels safer. That increases productivity, that reduces absenteeism, and it really improves the corporate culture and the corporate climate. And as you stated, I mean, there are many surveys out there that show a high percentage. We could just agree, the numbers vary from 20 to 50%, but a high percentage of workplace accidents are a result of alcohol. And a lot of fatalities in this country are the result of alcohol-related accidents as well. So if you can save the company money by having less injuries and save lives, makes a lot of sense.
So, and let me tell our audience that when Michael and SOBRsafe agreed to sponsor today's webinar, they didn't want it to come across as a commercial. So, I've actually inserted some slides that I think will help, sort of illustrate what we're talking about. But before we move on with the questions that we talked about asking, you said something just now, I'm trying to imagine in my mind. So if you have a SOBRcheck device at the entryway to the workplace, and you've got a group of people, shift of people showing up for the 8 o'clock shift. I mean, how long does it take to get them through that? I mean, because if you were collecting you were doing a breath test, for example, there would be some time involved in screening everybody before they got to work. Well, how's that work with SOBRcheck?
Well, actually, I can just demonstrate that for you live right here. So this is a SOBRcheck device. It was plugged in over my shoulder. I turned my camera off so I didn't have to spin around on camera. But this is the device. The way it works is it has two sensors. The one on the left side is scanning your index finger. The first time you use it, you touch it 3 times to record your biometrics. Think it's not your fingerprint, but think of it like your fingerprint. And that gets recorded into the portal so that anytime you log in or check into the workplace on a SOBRcheck device, you'll be identified as you. So you can't take a test for somebody else, right? That's a fail-safe built into the system. The middle, your middle finger goes over that little circle and it creates a chamber. And that chamber fills up with vapors that are coming out of your finger. When we drink, we exhale, if you think of it that way, alcohol everywhere in our body, including the tips of our finger. So when I put my hand on the device, it will start to flash yellow lights, and it'll flash 10 yellow lights. And basically it's sampling that chamber many times. And when it comes back right there, that's how fast it is. I came back green, which says that I'm alcohol free. And the, if I were entering the workplace, I'd be able to go into the workplace. If I tested positive for alcohol, that light would turn red. And my supervisor, the HR department would immediately get a text message and an email letting them know that I arrived at the workplace under the influence. And then typically companies will go through a protocol for anybody, just like they would if somebody had reasonable suspicion, right? At that point in time, you'd be interviewed. We usually have another one of these devices for the HR group as well, so that the person could go privately into HR and have a meeting. They could test again, make sure it's not a false positive. And then usually the company will then go through a process where they do a secondary test, either a spit test or a breathalyzer test. And then if they test positive again, send them for a full blood alcohol screening and drug screening at a clinic. When I say send them, have somebody take them, obviously. And to your point earlier, that's where people are going to be detected for other drugs, because the statistic that you just reviewed with everyone on marijuana and alcohol use as a combo, that really, there are similar numbers for opioid users and meth users as well. So the device doesn't detect those drugs, it only detects alcohol, but the process screens people out and eventually detects those people as well. And I should mention at this point, in case people are wondering, the red light, green light can be turned off, so that if people were lined up to come into the building, nobody's seeing anybody's results, if you will. It would just, everybody would be green, but in the background, if you tested positive, your supervisor and the HR department would still get the email and text message. And that literally goes out within seconds. So between testing and notifications, about 10 seconds.
Okay, so if you've got a whole shift of people showing up, it's not a problem to have them all do this.
We calculate, we work with the employer to say, okay, how many people will come to that choke point, if you will, or that entry point at the same time. Yeah. And with the same time being like within a 10-minute period. And usually we'll put one device for every 20 people, or sometimes it might be one device for every 15 people. So that's kind of the range.
So if a workplace has multiple entry points, you're not telling everybody to come to one entry point. You can just place a device at each entry point.
No, actually, one of the great things about the system, if a company has 50 of these, let's say, 20, whatever, depending on the size of the company, or 5, it doesn't matter. They're all daisy chained together. So the device actually connects to the internet via Wi-Fi or an Ethernet connection. Most people use the Wi-Fi connection. And so all the data goes up to the cloud, as it said in the video. We work in the Microsoft Azure cloud. So we picked that because a lot of healthcare and medical companies use that for data security purposes. So we collect all the information up in the cloud, and the company can access their data through that portal using a password protected browser. So they have access to that information instantaneously. And the number of devices, when I register the first time with my biometrics, that gets pushed to all the other devices. So I can go in a different door every day or a different door 5 times a day. doesn't matter. You could have them internally in the facility and require people to check throughout the day. One of the most common uses in the last mile delivery space is before you give the keys to a vehicle to a driver, you have them lay their hand on the SOBRcheck. They get a green light, they get the keys, and then when they come back at the end of the day, they test again to show that they were alcohol free throughout the day. And there, you're really creating a culture of prevention because typically alcohol stays in your system for about 4 hours. And so if you test at the beginning and the end of the day, it's a very, high probability you weren't drinking throughout the day.
Okay, so you've kind of answered this question here, but let me go to this. So, anybody who's in the drug and alcohol industry or you're an employee uses, you're going to recognize these. On the left is an evidentiary breath testing product, in the middle is saliva, and on the right is blood. Usually it's going to be breath or saliva, but those testing methods would require a little bit more time each test, and you would have to actually pay for each test. In other words, if you're using a device or you have to pay for each device, it sounds like you're really not talking about a per test fee structure.
Yeah, we actually, no, we sell this as software as a service. So we actually charge per employee per month. Okay. And that's unlimited tests for the employees. So if the company wants to scan everybody in the morning when they come in, that, the policy becomes up to the company. We just report presence of alcohol or not. So almost all companies, as you know, have a zero tolerance for alcohol. So we do have a threshold built into the system. The threshold would generally, since we're talking today to people in the industry, we don't report a number in the system. It's just literally a pass or fail. But behind the scenes, there's a very sophisticated algorithm. And that algorithm is taking into consideration the humidity in the room, the temperature, and any other ambient chemicals in the ambient air. All are sniffed by the sensor, and the algorithm then spits out a number. The equivalent would be to about a 0.02, 0.03, as people are used to talking about it in the industry. And that, that would equate, like I said earlier, at the conference, it took 1 to 2 drinks for people to test positive.
Okay, so let me say to the audience here, because I'm kind of anticipating some thoughts or questions they might have. So if you're a company either providing services to or a company purchasing services to comply with, say, the DOT alcohol testing regulations, you're thinking to yourself, I can't use this because I'm required under the regulations to use either an EBT or a saliva screening product. So my response to that would be that if you were interested in something like this, you would think of it as beyond what DOT requires. In other words, you're still going to test or screen for alcohol in compliance with the DOT regulations, but this would give you the opportunity on your own company authority through your policy to do something in addition to. It's sort of like the trucking industry. So in the trucking industry, of course, those companies have to conduct right now lab-based urine testing, soon lab-based oral fluid testing. As many of you know, those regulations are soon to be finalized. But many large trucking companies, in addition to complying with the DOT requirements, also conduct hair tests of their own authority, in addition to outside of the DOT regulations. This would be kind of the same concept if you're under DOT regulations or if you're mandated by some other type of state regulation. In Illinois, for example, where public works contractors have to conduct drug and alcohol testing, and the requirement mirrors the DOT regulations. Not that they're DOT covered in all cases, but those are the regulations that the state adopted. So you could actually envision using a screening product like this. Like Michael says, say a driver shows up in the morning, before they get the keys to the truck, they have to do this test and show that they're negative, and then at the end of the day, they might do the same thing. But it really puts you in a position, Michael, where you can screen for alcohol more frequently and avoid some of the consequences. One of the things I've heard you talk about is negligent retention. And I know we've got a slide on that, but what's that all about?
Yeah, so in today's world, one of the things we hear from people is that if we screen people all the time, we might detect people and we might lose some people. And that in this job environment, it's harder and harder to find people, so people are concerned about that. And that's really counter to most organizations that are really trying to create a different kind of culture, but it's certainly a valid concern that people have. And a couple of things about that. What we're hearing with regard to negligent retention, well, first of all, negligent retention is when you retain employees, this is layman's terms, not legal terms, but when you retain employees that are abusing drugs or alcohol, you're not doing anything about it. So if you know that every day you can smell marijuana behind the building, everybody's smoking at lunch, or you're finding bottles on the roof of the building, from drinking on the job, and you're not doing anything about it, the legal system isn't looking upon that very favorably. In fact, there are companies that are being impacted with, what are called nuclear verdicts, where the juries are giving million and even in some cases $1 billion verdict for against companies that have allowed different activities to go on and haven't done anything about it, thus negligent retention. So really, like I said earlier, our device, since it can test everybody all the time, instantly and in a very sanitary manner, it really levels that playing field and it really protects employers from that perspective.
Okay, now we're getting close on time, and I want to cover one other main point that I've heard you talk about. I put a slide in about I've heard you use this term return on detection. Most of us are, used to hearing the term return on investment. What's return on detection mean? And I've heard you use it in connection with, the cost of different types of insurance policies. So what's that all about?
Sure. Really, there are two buckets of savings that companies are getting. When we launched the product, we weren't really anticipating the insurance savings, but it's been a pleasant surprise. We were really focusing on some of the things I mentioned earlier: increased productivity, reduced absenteeism, improved quality in the workplace because people aren't under the influence. So those are positive returns by putting a detection program in place. But in addition to that, there are some real hard savings that our clients are seeing as well. So they're seeing reductions in their workers' compensation premiums, reductions in automotive premiums for liability when they have fleets. Their general liability insurance is impacted in a good way. And of course, if all your other policies go down, your umbrella policy goes down as well. We have an example here of a company who has actually saved over $200,000 in insurance. They have about between 210 and 220 employees at any given time, either driving for them or working in their warehouse. So there are some significant insurance savings that can happen. In the workplace, we're seeing workers' comp reductions in the range of 20%, umbrella reductions between 5 and 10%. It really adds up very quickly.
Yeah, and I think the difference here is that because traditional alcohol screening methods work, they're very reliable. They've passed the test of time, both legally and scientifically, but they're typically used not so much as a deterrent as they are sort of a reaction to an accident or to some of the type of reasonable suspicion scenario. What we're talking about here sounds more like prevention or deterrence that an insurance company would probably be willing to incentivize employers to do with savings on their rates. And I guess that's, I threw this in. This is not, this is just a graphic, but it shows how a company can experience net savings depending on the costs that are reduced in terms of insurance. Insurance companies.
That's the company that I was referring to. That's an actual client of ours that has saved I said over 200,000. It's actually over $250,000. And those are the 4 buckets of savings that that they experience the dollars in. So what we do we launch with people with the device, and then we'll work with their carrier to review the data. The data provides the evidence that you need to help negotiate with the carrier. What we're looking for in the future is for carriers to give a specific discount for our product. But right now, we work with clients to help them negotiate that with their agents, their reps, and even directly with the carriers. And we're in discussion with carriers about discounts. And one of the areas that we're anxious to move into is an area where we're going to implement this wearable device. This is a prototype. The actual device is going to be launching in August. It's a wearable. It has the same sensor. You put it on the back of your wrist, and it connects via Bluetooth to your phone and then back up to that same portal in the Microsoft cloud. We're launching this device in the teenage driving market. And we're going to put this on the arms of teenage drivers. And this will allow their parents to know that when they're driving the family car, that they're alcohol free. It also monitors their location via GPS. And if they take it off, their parents get a text message letting them know that they took it off and where they were when they took it off. So, and of course, the parents will have an app on their phone where they can actually go to a map and see where their child is. And we're working to find an insurance partner in this market because we've done research with the parents of teenage drivers, and we found out unanimously they would all have their teenagers wear this if they could get a significant discount on their car insurance.
Interesting. So when do you think that will be available?
This will be available in August. We're actually launching it in several markets, but we're launching it first in the rehab space. We're working with a rehab company in the state of Washington. They're going to launch the product as part of their brand new alcohol rehabilitation program. They do virtual rehabilitation. So they're also a startup and a really breakthrough product that I think will be a game changer in the rehab space. But we'll also be introducing the product to other rehab companies as the next year rolls around.
Okay. Well, we're almost out of time. I'm just going to put this slide on. I always try to provide some kind of prediction for the future, depending on the topic of the webinar. I'll put this one up there. Want to share a couple of questions now. We've got questions, and so I'll just throw out a couple of questions, Michael, that either you or I can answer. But I know we're running out of time. If there are any questions we don't get to today, or if you weren't able to submit a question or a question wasn't, submitted, then we'll respond afterwards. We'll either send you an email or if you'd like, we can call you and go through that. Among the things I'm predicting for the future, and yesterday I did a presentation on 5 things you should know about marijuana in the workplace. And one of the things I predicted was that we're going to see more marijuana use and fewer companies testing for marijuana. I'm not saying either of those things are good. I think that's where the trends are right now. And as we review from that one study, the use of marijuana going up, the connection between marijuana use and alcohol use being, indisputable. And so you're going to see more people testing positive for marijuana in the workplace and more people being under the influence of alcohol at the same time. So the negative consequences of that are pretty clear. So 2 predictions I'm going to make about the future is I think you're going to see a shift in the drug testing industry, the drug and alcohol testing industry, to more of a focus on fitness for duty. And we're already starting to see that happen, where companies are maybe not accusing somebody of being a drug addict or an alcoholic, but basically just saying, we're really just concerned about your fitness for duty today. And so, you take the SOBRcheck screen, for example, and it's not diagnosing you as a person with an alcohol use disorder. It's just saying that under these circumstances, we don't want you driving one of our school buses today. I think you're going to see more of a shift from drug testing for detecting drugs and alcohol screening for detecting alcohol as sort of a punitive policy to more of an identification of fitness for duty and preventing rather than detecting and accusing. I've been in the drug testing industry for over 32 years now, and I was asked about SOBRsafe at the NDASA conference, and the term that I was quoted is, I think it's a game changer. I think it's going to have a major impact on how companies address substance abuse in the workplace, particularly alcohol use. And Michael, we just have 1 minute left. Is there anything you want to add in conclusion?
No, Bill, I just want to end on that too. Really what we are about is trying to help organizations create a healthier, safer work environment through prevention. And really, when I talk about the products that we're launching in the teenage driving space and in the rehab space, we really believe that we can help save lives, and that's really part of our mission. So we're anxious to talk to people about either product, and if somebody wants to contact me, there have been some inquiries already about this product for over-the-road truckers and for mid-range fleets, and we'd be happy to talk to people about those as well as other situations as well.
Thank you, Michael. Thank you, everybody, for joining us. And Jessica, I think we're right at the top of the hour.
Great. Thank you so much, Bill and Michael, for your time, your expertise, and for introducing us to the future of alcohol testing in the workplace. We'd like to thank those of you who attended today's presentation for your time and joining us. As was mentioned at the beginning of the presentation, this webinar was recorded, and you will receive information on how to access that recording. Additionally, this presentation qualified for continuing education credits for those who attended the entire live presentation. If you fall under that category of having attended the live presentation, then we will send you that information via email. And with that, this concludes today's webinar presentation. Thank you and have a nice day.
Thank you.